What's up guys? This is Dr. Paul here. My wife Nora and me regularly publishing various health tips here in this channel. Subscribe our channel to keep you healthy. Today I will let you know what is type 2 diabetes and how to reverse it. When you have type 2 diabetes, your body makes a lackluster display with regards to transforming the sugars in nourishment into vitality. This causes sugar to develop in your blood. After some time it raises your danger for coronary illness, visual impairment, nerve and organ harm, and different serious conditions. It strikes people of all ages, and early side effects are gentle. Around 1 out of 3 people with type 2 diabetes don't know they have it. What will you notice first? People with type 2 diabetes regularly have no side effects. When they do show up, one of the first might be being thirsty a lot. Others incorporate dry mouth, greater longing, peeing a considerable measure, in some cases as frequently as consistently, and strange weight reduction or increase. You should know about some symptoms. As your glucose levels get higher, you may have different issues like cerebral pains, obscured vision, and weariness. Some serious problems could be a signal. Most of the time, type 2 diabetes isn't found until it takes a genuine toll on your well-being. You can notice some warnings. Number 1. Cuts or bruises that are slow to heal. Number 2. Incessant yeast diseases or urinary tract contaminations. Number 3. Bothersome skin, particularly in the groin area. It can affect your sex life. Diabetes can harm veins and nerves in your private parts. This could prompt lost feeling and make it difficult to have an orgasm. Around 1 in 3 who have diabetes will have some type of sexual inconvenience. Some risk factors you can control. Some health habits and medical conditions identified with your way of life can raise your chances of having type 2 diabetes. Number 1. Being overweight, particularly at the waist. Number 2. A sofa potato way of life. Number 3. Smoking. Number 4. Eating a ton of red meat, prepared meat, high-fat dairy items, and desserts, and some risk factors you can't control. Number 1. Family history of diabetes. Having a guardian or sibling with diabetes helps your chances. Number 2. Your age. Being 45 and more established raises your danger of type 2 diabetes. Number 3. The more hazard variables you have, the more probable you'll get type 2 diabetes. So, how is it diagnosed? Your doctor will take some blood and do an A1C test. It demonstrates your normal glucose level in the course of the last 2 to 3 months. Your diet makes a difference. You can control glucose levels by changing your eating routine and losing additional weight. Observe the amount of fat and protein you eat, and cut calories. Exercise is important. Standard activity, similar to quality preparing or strolling, enhances your body's utilization of insulin and can bring down glucose levels. Being active also helps get rid of body fat, lower pulse, and shield you from coronary illness. Relaxation is key. Anxiety can boost your blood pressure and blood sugar. Some people don't do anything for it. Others swing to sustenance to adapt to it. Rather, practice relaxation techniques like profound breathing, meditation, or representation. Conversing with a companion, relative, advisor, or religious pioneer could help. Insulin. It's not just for type 1. Doctor may recommend insulin at a very early stage in your treatment and join it with pills. It can likewise people with type 2 diabetes who create beta cell disappointment. This implies the cells in your pancreas no more make insulin when glucose is high. In the event that this happens, insulin will turn out to be a piece of your day-by-day schedule. Why blood sugar testing matters. Your specialist can demonstrate to you proper methodologies to utilize a glucose meter to check your glucose. This tells you how your treatment arrangement is functioning. How regularly and when you test will be founded on how very much controlled your diabetes is, the kind of treatment you utilize, and how stable your glucose is. Basic testing times are the point at which you wake up, previously, then after the fact dinners and exercise, and a sleep time, heart and artery troubles. If you don't treat diabetes with a sound eating routine and activity, you'll probably get plaque in your veins than individuals who don't have it. The sticky substance moderates bloodstream and builds your danger of clusters. It prompts solidifying of the veins, which makes you more inclined to show some kindness, assault or stroke. Around 2 of 3 individuals with diabetes pass on of coronary illness, kidney complications. The more you have diabetes, the more noteworthy the chance you'll get constant kidney ailment. Diabetes is the main source of kidney disappointment. Eye problems. High glucose can harm the modest veins that convey oxygen and supplements to the retina, a basic piece of your eye. This is known as diabetic retinopathy, and it can prompt vision misfortune. It's the main source of new instances of visual deficiency in individuals between the ages of 20 and 74. Foot injuries can take a toll. Diabetic nerve harm can make it difficult to feel your feet. You won't not see wounds. In the meantime, solidifying of the veins lessens bloodstream to the zone. Indeed, even a little damage can bring about foot bruises and gangrene. In extreme cases, diseases can bring about a removal. Now, most probably you are thinking, can it be prevented? One of the most surprising things about type 2 diabetes is that you can avoid it. To lower your risk, follow the same guidelines for warding off heart disease. Number 1. Eat a solid eating regimen. Number 2. Exercise for 30 minutes, 5 days a week. Number 3. Stay at a solid weight. Number 4. Converse with your specialist about being tested for prediabetes. Number 5. People with prediabetes can avoid getting diabetes with lifestyle changes and medication. Finally, I will tell you, follow your doctor's guideline. If you want to know more about this disease, please click the link below in the description and don't forget to subscribe our channel. Thanks for watching.